This segment is sponsored by PAN Foundation. This fall, more than 67 million Americans on Medicare will face one of the year's most important healthcare decisions, open enrollment. A new national poll from the PAN Foundation's Center for Patient Research sheds light on the biggest concerns patients are facing when they consider their Medicare coverage. Joining us to break it all down is Amy Niles, Chief Mission Officer at the PAN Foundation. Hi, Amy.
Hi, thank you for having me.
Thank you so much. Can you help us break down Medicare open enrollment and what that means for 2026? Things like key dates, deadlines, and why this window matters for prescription drug coverage, Part D.
Absolutely. Medicare open enrollment is that critical time of the year when people on Medicare compare plans, including prescription drug coverage, to find that plan that best meets their healthcare needs and budget. We know that plan costs and coverage can change from one year to the next. And in addition, individual healthcare needs and budgets also change. So really important if you're on Medicare to take time during open enrollment to evaluate your plan options. Now, open enrollment starts October 15th. It goes until December 7th. Any changes that are made during that time period take effect on January 1.
Thank you. Important dates. Thank you for sharing. The PAN Foundation's new national poll revealed top concerns from patients as they evaluate plans for 2026. What insights can you share from that?
Yeah, we were disappointed to learn that only 1 out of 2 people on Medicare intend to evaluate and change their plan during this open enrollment period. This amidst rising concerns about costs, increased out-of-pocket costs, increased premiums and deductibles. This concern is exactly the reason why people on Medicare should take time during open enrollment to evaluate their plan options.
Very interesting. What common pitfalls should we avoid during open enrollment? And can sticking with the same plan cost people more in the long run?
It very well may cost more. You know, costs change from year to year, and things are changing a lot in 2026. So important for Medicare beneficiaries to take time to evaluate those options. Review that annual notice of change that comes from your plan, because that document will identify the changes that are occurring in your current plan this year to next. Importantly, take time to think about your own healthcare needs and budget. What changes do you anticipate in the coming year? What medications do you need? What healthcare providers do you need? And from a budget perspective, what can you afford when it comes to these out-of-pocket costs, premiums, and deductibles?
Yeah, so it's really important to take the time to think through all of this. What are some key things to consider when comparing plans? And do you have any practical, simple strategies we can use to ensure the best fit for individual healthcare needs?
Really, the most important step that someone on Medicare can take is to use Medicare Plan Finder. This is a free tool that can be found at medicare.gov. And in a matter of minutes, and after inputting some basic information about yourself, where you live, the medications you take, the pharmacies that are near you, you will see the range of plan options in your area. And then it will be a little bit easier to compare and identify the option that's best for you. On top of that, at PAN, we offer a range of educational resources about Medicare in general and open enrollment. Those resources can be found at panfoundation.org/open enrollment.
Thank you so much for taking the time. This is all really important information.
Thank you so much for having me.
Of course. Again, for all this information and more, head to panfoundation.org/open enrollment.